This is Dr. Thomas Klein. I am a chronic and rare disease specialist in Raleigh, North Carolina. We belong to a mutual group of physicians, nurse practitioners, nurses, patients, etc. And this is the name of our organization. And you can Google it down here, jatheducational.com. It will take you to everything else, all the papers and everything that you wish to copy. So this is a JATH presentation. Our topic today is alternatives to pain medicine are safe and effective. If you read the CDC guidelines, which is, as I mentioned, a very difficult task due to the way it's organized, but if you word search things like alternatives in the document, you'll come up with these alternatives. And there's a discussion of a lot of alternatives. Why do we need alternatives? Remember that PROP and the CDC, these people working together, have decided that opiates are dangerous, and maybe they work for emergency rooms and after surgery, but definitely not for long term. And what is this based on? This is based on a PROP member or PROP ally by the name of Chu, C-H-O-U, Roger Chu, at the University of Oregon in Portland. He has made and has tried to cultivate the notion that since we have no studies to show that opiate pain medications work over the long term, we should stop using them. Let me see if I can find Jane Ballantyne, president of PROP, is an anesthesiologist, and she was at the Mass General in Boston, and now she's at the Washington Group in Seattle, which has 4 or 5 PROP members. We know who the PROP members are, and they all are buying into the same philosophy that opiates are too dangerous to use and they don't work. Neither of those is true, which has been the point of some of our little talks here. The executive director, Dr. Kolodny, who is a psychiatrist from Brooklyn, wrote that opioids are rarely the answer for the management of chronic pain. Based on what? There's no reference here. There's nothing to say that he did his own study or survey. Now, we have a group that JATH queries of pain management specialists. These are specialists in how to control pain, and representing 125 years, possibly 30 to 40,000 patients. So we query them every once in a while. And the first question we ask them is, how many of your patients addicted? The answer was none. How many of your patients overdosed? They couldn't remember any. Remember, this was 40,000 people. Now, they all feel that these medicines work, and if you don't know whether or not these medicines work, why don't you ask people? So we have 30,000 people following us on Twitter, and it makes for a good platform for taking little surveys. So we took a little survey, and we said to people, how many of you feel that these medicines are effective? 90%. But what these people will say, the only reason for that is because they're addicted, and if you take them off, they'll develop dependence. Remember last time, dependence? And that's their argument. Again, that's called flat statement science. They make a flat statement. There's no references. There's no logic presented. In the absence of scientific studies, you can always use logic. The moon is yellow. Cheese is yellow. Therefore, the moon is made of cheese. So if you use logic properly, you can get to the bottom of a lot of questions with just the rules of logic. We're hearing a lot of bad words now about people who are being taken off their medicines, that opiates, opiate use, misuse, abuse, diversion, overdose, and death. That's kind of a negative picture of a very safe medication. That's a picture we could paint for a lot of medications. There's very serious consequences of the called biologicals that are being used in arthritis. People have their immune system suppressed, but we don't stop using them. Here's another comment. Patients truly believe opiates are helping them because when they don't take their opiates, they're feeling pain and discomfort. So if you need pain medicine and you stop it, your pain returns. This is a bizarre way to look at something that has been in practice for a long, long time. In order to set aside pain medicines after 50 centuries, you have to have a really strong argument. They made the argument to the FDA asking them to limit pain medicines. The FDA said, sorry, your argument is not cogent. The general public doesn't realize that opioids have the same impact on the brain as heroin. That's a direct quote. Doctors didn't need to reduce the intensity of pain in order to treat it. This is another thing that this group and CDC, which you can kind of think of as joined at the hip, since these people wrote most of the guidelines for the CDC. They argue that you're not really trying to reduce the intensity of the pain. What are we doing? I mean, what an absurd statement. Doctors don't need to reduce the intensity of the pain in order to successfully treat it. So then they say, well, what you need to do is you need to treat it with alternatives. Because they're not dope. They're not going to cause you to become a dope fiend, and that we're very frightened of that because they're liable to come and kill us. And we know that the percentage of addiction, even admitted by Jane Valentine, is very low. So what's this all about? Well, we've said before, this is about fear of addiction, phobia. The fear that somebody's going to kill you. And that's what the real fear is. This is an article that Jane Valentine published in the New England Journal of Medicine that got so many negative comments. The Journal of Medicine did something unusual, and they actually took comments on this. Basically, it says there's little evidence supporting the use of pain medicines in the long term, and therefore don't use them. All right, so let's take a look at some of these alternatives. What they've done is they have compared the alternatives to a placebo. Physical therapy works, Tai Chi works, but they never compared them to pain medicine. That's sneaky. If you want to find out if Tai Chi works as well as pain medicine, you do them both. You have some people do Tai Chi and some people take pain medicines. Spinal stimulators. I asked the question, is it worth it? 86% said no. Physical therapy by itself helped 10%, some 20%. Made things worse, 44%. So doctors are just sending people off to these alternative treatments that don't work, are more expensive, and have more side effects. We asked the question, if you use these alternative treatments, did it allow you to cut down on your pain meds? Only 11% said yes. Lyrica, a very popular drug recommended by CDC. Noticeable side effects, 72%. No problems in only 17%. So the majority of the people, it did not work and they had side effects. Oh, here's the substantially helped. Lyrica substantially helped in 8%. 19%, yes, somewhat, did not help 3/4. 3/4 of the people taking this recommended drug have more side effects, spend a lot more money, this stuff's $600 a month, and it didn't help. Same with Neurontin, which they recommended. Back surgery. 1/4 it worked, 3/4 not worth doing. Neck surgery, not worth doing, 70%. These are all these alternatives that the government wants you to do. This is the government. This is the CDC, the government. Alternatives work fine as adjunctive treatment, which means in addition to. You treat people with pain medicine, it takes care of 80%, and then you can do these other things, and they help a little bit more, and they add on some stuff. But to think and have a government agency recommending that you do Tai Chi instead of taking pain medicine for your chronic and rare painful disease is an issue that needs to be looked at by the United States Congress. Thank you.